How are you doing today?
I'm doing good.
Okay, well, I'm here to talk to you about your exercise program. And first, I'm going to start off with a couple of questions, if that's okay. And please answer as honest and as best to your knowledge, if possible.
Mm-hmm.
Okay, so has your doctor ever said that you have a heart condition or high blood pressure?
No.
Do you feel any pain in your chest at rest during your daily activities of living or when you do any physical activity?
No.
Do you lose balance because of dizziness or have you lost consciousness in the last 12 months?
No.
Have you ever been diagnosed with another chronic medical condition other than heart disease or high blood pressure?
No.
Okay. Are you currently taking any prescribed medications for a chronic medical condition?
No.
Do you currently have or have had within the past 12 months a bone, a joint, or a soft tissue such as muscle, ligament, or tendon problem that could be made worse by becoming physically active?
No.
And has your doctor ever said that you should only do medical supervised physical activity?
No.
Okay, and there's just a couple more questions that I need to ask you. Do you experience any discomfort in your chest or pain in your neck or jaw or your chest, arms area?
No.
No? Do you ever experience shortness of breath during rest or mild exercise?
No.
Do you experience any dizziness?
No.
Okay, do you have any sensation of breathlessness or a sensation of shortness of breath that wakes you up?
No.
Okay, do you have any ankle edema, like such as swollen ankles or feet?
No.
Okay. Have you ever experienced like a myocardial infarction, which is like a heart attack?
No.
Okay. And do you experience any cramping in your leg or anything like that when you're doing any physical exercise?
No.
Okay. Do you have a known heart murmur?
No.
Okay. And do you experience any unusual fatigue or shortness of breath with usual activities during your day-to-day life, walking anywhere?
No, I don't.
Okay. And can you tell me a little bit about your family history?
Well, my dad recently underwent coronary bypass surgery at the age of 49, and my mom, who's 47, she has type 1 diabetes.
Okay. And can you tell me a little bit about yourself, maybe your physical exercise, your daily activities, what you do on a normal day?
I play in a soccer team, and I do resistance training 4 times a week with the team. I also cycle to and from school for half an hour, which is about 10 miles, for several days in a week, about 6 days.
Okay.
And in some occasions, I play basketball with my friends.
Okay. Awesome. So, based on your charts and some of the numbers I got back, there are a couple things that I do want to talk to you about for your physical exercise program. So, since you're already extremely physically active, you do your 6 days a week and you're doing over 10 miles during the week and strength training 4 days a week, you're at a vigorous exercise level, and I would like you to keep it that way so you don't have any more increasing symptoms or any higher risk factors for cardiovascular disease.
Mm-hmm.
So it's important to keep up your active lifestyle to avoid any cardiovascular diseases, especially due to your family history with your dad just having his surgery. That could probably put you at risk for a genetic disposition, so that continuous exercise is going to definitely lower those risk factors instead of increasing them.
Oh, I also forgot to mention, I sometimes usually smoke.
Oh, okay.
So,
you sometimes usually smoke?
Yes. So I don't know, you should take that
Okay,
into
yeah, thank you.
consideration.
Thank you for letting me know that. Yeah, and so because of your smoking, that's also something to be aware of. It will increase your risk of coronary heart disease.
Mm-hmm.
So that's just something to be aware of. Maybe if you choose to want to cut down, that is up to you. But that's just something that you should be aware of. And something else is your blood glucose. So it's at a 97. And anything over 100 can, you're kind of in that range for pre-diabetes. So that is something to be very careful of. Make sure you're paying attention to that, especially before you exercise, things like that. And for your total cholesterol, that is also something that I did want to talk to you about. So your lipid profile is over 220, and the recommendations would be under 200, so keep an eye on your cholesterol, continue exercising in order to decrease those cholesterol levels, and yeah, that's about it. Do you have any questions or anything? Any concerns, comments?
No, you did a good job telling me what to do.
Thank you.
All right,
Nice to meet you.
Nice to meet you too.